to go.
Thank you. I will call the meeting to order. Can we take the roll call, please?
Better unmute myself. I see all members of the committee here, Chair Burley.
Thank you. And you can declare a declaration of community interest anytime you see fit during the meeting. Welcome, Warden. I'll move on to the agenda. We're down to our reports. Rockwood Terrace Operating Report. It was moved by Councillor Woodbury, second by Councillor Robson to put it on the floor. And Karen, I believe we'll turn it over to you.
Thank you, Mr. Chair. I'm just trying to get out of my full screen here so I can see the report. There we go. All right. Some of this stuff, when I was writing it, so much has happened. It feels like it happened so long ago. So it was a good refresher. Anyway, the first page there is our quality indicators. As you can see by the colors, we're doing well as or better than provincial average in everything but wounds. We continue to work very hard on this area, and you may recall with the budget passing, we got an extra day a week for our wound care nurse, so we're hoping this will help us in the the ministry has not been in the homes or in our home for the duration of this report. However, they have been in contact to offer support and information. And even over the weekend, we get an email on the Friday night to say you can reach someone should you need someone over the weekend. So that's been good. People-wise, I just wanted to put a shout out there to the entire team at Rockwood because everyone has really pulled together to move to room service, which we did back on April 6th. At mealtimes, it's all hands on deck, and everybody has been very good without complaint to be there ready to support our residents. So I just wanted to give a shout out to everybody. Projects and location events are all listed there. I won't go into each one, but you can see we had lots of things happening right up until Tuesday, March the 12th, when life, as Terry wrote it, drastically changed. So nowadays, it's all electronic, phone calls, FaceTime, Skype. Over the past week and a half or so, we started window visits again. So everybody was kept very busy on the weekend between handing out things that have been dropped off for Mother's Day and arranging these visits. The visits have been very well received for the phone calls, so that's been great. Families are very appreciative. We are very fortunate to have a musician on our program staff, Kara Smith, who is actually in the process or has released a CD. So she's very good, and the residents really love it when she brings her guitar and walks the halls. We also had the Assembly Bunny come just prior to Easter, so that was good. Occupancy, as you can see, remains quite high. There was, just prior to the shutdown, an inspector from Public Health who attended the care community and inspected the main production kitchen. There were no violations as a result of his visit. Annual testing of the fire alarm system was held in February. Fire drills were held on 2 shifts only in March. Unfortunately, we missed getting the evening shift done with everything going on, but we did better in April. We are currently renewing mass fit testing for all our team members and have everyone done now but a small handful. Several interventions were put in place related to COVID-19, and I think there's a separate report about that, so I won't go into that. During the period, we did receive a written complaint related to the fact that the Saugeen Suite, which is our palliative care room, but is also used for various reasons throughout the year, was in use when a resident was palliative and therefore not available for their family member. We did provide a written response, and we have had a meeting, Jen and I set up with this family member, I think since March, and we've had to postpone it a few times because of COVID, but we do have it set up again for early June. We did offer a virtual meeting or a teleconference for this family member, but they chose to wait in hopes to meet face to face. As far as compliments and color, we really have been overwhelmed with the support and kindness received from family members, community at large during this time. It's just, people think of things that I would never think of to do, between sending food, paying restaurants to send food. We've received flowers, we've received hand sanitizer, we received an iPad, many cards and phone calls, and everybody's very appreciative. There have been no resident or family council meetings during the reporting period. And that's it, unless there are any questions.
Thanks, Karen. Does the committee have any questions? I think maybe I'll just back up a wee bit. It'd be appropriate if I read the motion first. That LTCD CM 1220 Rockwood Terrace operating report to the Committee of Management for the period of February 15th, 2019, April 14th, 2020 be received for information. Since there's no questions on the report,
Just
I
a quick
will
question, Mr. Chair. Can I have a quick question?
go ahead, Mr. Warden.
So it's sort of outside your report, but I guess in general, Karen, with regards to the good news that we have secured a location for the new Rockwood Terrace, I don't know if that's inspired some positiveness in the facility, or maybe Jennifer. I know it's good news that we're moving forward. I just wondered if that has, made a smile on people's faces.
If I may, Mr. Chair, it certainly was a bright light that came at a very opportune time. So yes, it has sparked conversation, again, conversation other than COVID. So great. And I think people were pleased to find out it's going to be an adjacent property, mostly because they think they can keep an eye on the proceedings, I think, from where we sit. So yeah, it was very well received.
Thanks for that,
So,
Mr. Warden.
just to follow up, Mr. Chair, so they can be the armchair contractors.
Yes, exactly.
That's great. That's good. Thank you.
Thanks, Karen. What I'm going to do, I'm going to ask for a show of hands for those in favor of the motion before us. All in favor? I see, okay. Thanks, Karen. So I'm going to move on with our next report. That LTCM CRCM 1320 Grey Gables operating report to the Committee of Management for the period of February 15th, 2019, April 14th, 2020 be received for information. It was moved by Councillor O'Leary, second by Councillor McKay. And I'll turn it over to Shannon.
Thank you, Mr. Chair. So the first is the quality report, our quality indicators. As you can see, we are better, or mostly better than the Ontario average, but we are working on our worsening behavior symptoms and the worsening mood from symptoms of depression. So those are the two that we are mostly working on. For ministry visits, we haven't had anybody in-house, but we do have weekly operating reports that they check in on us. And I did ask her about the director's referral, and that is going to be held off until after COVID is over and that they are able to get their feet under them, I guess, as well. As for outbreaks, during this reporting period, we did have an enteric outbreak of 2 residents and 2 staff, but nobody was hospitalized and there was no deaths. And that was cleared before everything else changed. Under people, Grey Gables did attend 2 of the job fairs that happened in Hanover and in Owen Sound in February. We did get lots of people attended, but there wasn't many PSW applications, or there wasn't too much potential there yet. But we have since then been able to hire some employees, so that's been good. Crystal McKay was offered the position of the PSW coordinator that she took. She has been at Grey Gables for many years as a nurse and also as our RI coordinator. So with her taking that position, we are going to now be hiring for a RI MDS coordinator. Crystal and Kim Mustard have been training redeployed staff. So at our facility, we have trained over 60 county employees to be redeployed if needed for COVID, if it happens. Yeah, Grey Gables is very thankful for the redeployed staff that we've had. They've been excellent. They've been doing a lot of our screening at our doors. They've also been helping with one-on-one visits and helping set tables at sometimes, helping in laundry. They've been very, very good and helpful. From the community, we have also received many donations. Our main ones, like big ones, but not our main, Bruce Power, Chapman's, and Markdale Hospital have given bigger donations, as in like iPads and food and PPE. But we've had lots of acts of kindness with cards and pictures and flowers being dropped off, just really, and a lot of the scrub, I guess they're called scrub caps, with the buttons on the side so that it helps when you're wearing a mask to relieve the pressure of your ears. So everybody has been very thankful for those. Under projects, so in February, we had the annual Pancake Luncheon for Shrove Tuesday, where management had cooked all the pancakes. And then in March, we started the Color It Connect program, which is allowing the residents and families to connect using technology, which has gone over really, really well. And actually just over Mother's Day, sorry, just over Mother's Day, the residents were actually saying that it was much nicer to be able to connect one-on-one than having a group program. So that was really nice to hear. So all the ladies got to connect with their families on that day. We've also we had Easter as well, which they did the Color Connect program with them as well. Spiritually, that's been happening over FaceTime, as well as our social worker has been coming in and doing counseling as well that way. Sorry, not coming in, but doing it over FaceTime. And families are very much appreciative of everything that we are doing at Grey Gables as well. Occupancy, so we are full. We did receive 2 more temporary beds as well. We are at 68 instead of 66. And they are going over well. We also have made some environmental changes with our home and added isolation rooms. So 1 more room on every wing, so that if needed, when we have been using them for admissions into the home, or if somebody has been swabbed, they're being moved into these isolation rooms until we hear back the results. So. Under environmental, we have had our code reds, and we also did a code blue in April, where we had a staff member pretend to have a medical condition, and that went over really well. We've had our hot water replacement for a capital project. And then, yeah, on March 13th, everything really changed within the home, but we've done a lot of isolating and social distancing and trying to keep our residents safe and our staff safe. Yeah, so we haven't had any visitors into the home. I shouldn't say, we did have 2 essential visitors come in when we had 2 residents that were palliative. They were able to come in on full PPE, but just 1 person for the family or out of the family. And then our leadership team has also been divided into 2. So only half of the leadership team is in the home at one time, which helps keep everybody hopefully safe. We haven't had any written complaints in this reporting period. And Color It Story back, it seems like a while ago now, but back in February, we had the snowstorm, which closed down our roads. And we did have a family that was stranded, so we let them stay in the home, in our front entrance or front vestibule there, not vestibule, lounge. And they were very helpful and very appreciative of the what we do, and they actually were helping out. They did, helped played some bingo, and they helped set some tables and shoveled some snow for us. So that was very nice, and they were very much appreciative of us letting them stay. Yeah, so we had, oh, I should have said, I might have missed something. Back in people, when this COVID started, we did have 1 employee who has refused work because of, she didn't feel safe, but we talked to the ministry, we've talked to everybody, and they've agreed that we've done everything that we needed to do, but that she has still remained off. So, and then under family council, we did have 1 meeting, and John was attending it, and he showed them the new tub room that was completed. And other than that, everything else has been closed. Thank you.
Thanks, Shannon. Does the committee have any questions? Seeing none, everybody's smiling. All in favor of the report, the motion? It's carried. So we'll move on for our next report. That LTCR CM 1420 Lean Manor Operation Report to the Committee of the Management for the period of February 15th, 2019, April 14th, 2020, be received for information. The motion was moved by Councillor Klumpus, second by Councillor Leary. And I'll turn it over to Renee.
Thank you, Mr. Chair. For our quality indicators, we are better than provincial average, except for one area, which is worsening activities of daily living. We continue to focus on worsening mood and skin and wound and depression. We are working with our skin and wound nurse, and she has been very effective in keeping our skin care and stage 2 to 4 ulcers under control. We did not have a ministry visit during this report, although we all have weekly updates with the ministry, and they offer support during this time. We did have 2 outbreaks. We did have several outbreaks, actually, for influenza A and an enteric outbreak. There were no deaths with these outbreaks. It affected both the residents and the staff. We are pleased to announce that Paige Caswell is our new nutrition manager effective March 16th. She started at the beginning of COVID, and she has risen to the occasion and jumped right in there and has made sure that dietary and nutrition is well looked after during this time. We are also very thankful for the redeployed staff. We have redeployed staff working with us in activation and the Color Connect program. We also have one redeployed staff member doing as an emergency support worker, one in the kitchen, and one person in dietary. And we are very, in the office, we are very, very thankful for their support. They also are screeners for us. So we, I'm not sure what we would have done without them. They have been incredibly helpful to us. Well, again, it seems like a long time ago, but in February with the snowstorm, that was the talk of the day with the major blizzard that happened. And then with the fire down in Australia, the residents made pouches for the baby kangaroos, and then life changed. And there were many things that we put into place to assist the residents during this time. We do hallway bingo. We've done activity bingo. Bingo cannot be stopped even during COVID. We have staff challenges that include the residents. So we've had cowboy days. We've had karaoke days in the hallway. We've done neighborhood time. We stopped social programs or group programs, and we do neighborhood time, and the residents receive one-to-one visits from the recreation staff. We've done we sing O Canada every Sunday at noon. The residents and the staff are encouraged to wear red, and we stop for a moment to sing O Canada. We are taking many pictures during this time, and we've put together some iMovies and some posters with the activities that have been happening throughout the home. Our occupancy is at 99% year to date, and we also have one additional temporary licensed bed, so we are at 151. We had, for stakeholders, we had the Electrical Safety Authority in and audited our logbook, and there were no defects. We are running paper code red drills through these last few months. And there is a report on all the things that we have done for pandemic. We have received also incredible community support and food from local restaurants. We have also received an iPad and donations from Bruce Power. Our families drop off cards and flowers. We created a Color It compliments board in the main lobby for all the staff to see, where we post the cards and all the compliments that we're receiving. We also had the emergency services do a drive-by, and that was quite overwhelming to see the police and EMS and the fire trucks drive through our parking lot and give support to the residents and the staff. And yeah, are there any questions?
Thanks, Renee. Does the committee have any questions? Councillor Mackey.
Thanks, Mr. Chair. Just a comment for all three executive directors and our three homes. The performance indicators, it's really nice to see the work that everyone's done and the improvements in the performance indicators. So, thanks to everyone for addressing those issues, and it's nice to be above the provincial standards.
Thanks, Scott. Is there any other questions? Councillor Klumpus? You're muted.
There I am. I just wanted to follow up with that. In these days of what everybody is going through, and the notice that our particular hotspots and areas of worry are our long-term care homes, it must be that much more of a stress and strain on staff to keep spirits up and to provide the services that are needed for these residents. And I just want to offer my congratulations again. Reading these reports, it's very obvious the quality of staff that we have in place and the efforts that are being made to make life as normal and as easy as possible for these residents, particularly at this very hard time. And I can well imagine going home. We were talking about at the end of the week and the end of the day, we're all feeling absolutely exhausted, but that must happen every day for you folks in the long-term care situation, because it seems the pressure to keep spirits up and to be up yourself and just to maintain a normalcy as much as possible has to be a terrific strain. So thank you and congratulations.
Thanks, Barb. Before I ask the vote, I'd like to put a question out to the three directors and Jennifer again. I often wonder about the flu epidemic that usually comes into homes sometimes and so on with the COVID. How do you separate the two? That must make it very, very hard.
Renata, would you, as a nurse?
The nurse? Well, we did screen for influenza, and we are swabbing for COVID at the first sign of anything, any sniffle, etc. The influenza was prior to the COVID, and since then we haven't had an influenza A case or any other respiratory type virus that has showed up. All of our swabs to date have been negative. And I meant to mention that yesterday, Lee Manor was swabbed, all the residents and the staff. So we did over 330 swabs yesterday.
And I'll just add, Mr. Chair, that when we notice any sort of symptom, we do that isolation and we do a test. And the test will test for COVID as well as other respiratory infections. So we're able to then have a better idea of what it might be. And sometimes we know it's not COVID and we know it's not influenza, but it's some other respiratory something, and we isolate and provide care for those symptoms.
Thanks, Jennifer.
Mr. Chair?
Go ahead, Christine.
Thank you, and through you. One of the reasons that I didn't have a question this time around is because obviously, like the rest of the committee, I'm paying attention to the performance level of each of the homes, and it's exceptional, extremely well done to each of you as our executive directors and to your staff. So there was no question that I had, but I do want to comment as well, as Mayor Columbus did and Mayor Mackey, and that is that the compassion and the quality of service that you and your staff provide is absolutely outstanding, and it certainly is amplified during this pandemic. So thank you very, very much to each and every one of you. You have put the support in, you've shown the leadership for your staff, and it's just wonderful to see, and thank you so much.
Thanks, Christine. Great words, and I echo the same comments. Very good. I'll ask for a vote on the motion before us, please. All in favor? It is carried. So moving off our agenda, we're down to 1620 long-term care. That report LTCR CM 1620 regarding the long-term care COVID-19 status update be received for information. It was moved by Councillor Mackey, second by Councillor Woodbury to put it on the floor. And Jennifer, are you going to do this report?
I am. Thank you, Mr. Chair. So I'm just going to highlight from the executive summary and then see if there's any questions. So the testing numbers regionally have increased, and as Renata mentioned, the homes are being universally tested. So yesterday it was Lee Manor, tomorrow is Grey Gables and Rockwood Terrace. Yeah, tomorrow is Grey Gables and Rockwood Terrace. So even though the testing numbers have universally increased, we continue to not have any COVID-19 cases or outbreaks in any of our 3 homes. I'm echoing in the executive summary what I've heard you say, that the staff's compassion, positive attitudes have assisted our residents during this time. the departments are working together, the teams in the homes are working together, the teams across the 3 homes are working together. We continue to do a daily check-in by Zoom with all 3 leadership teams on the call every day, finding out what are the newest updates, what's some success stories, what are the challenges, and sharing that across all 3 homes. The EDs highlighted the community's support and rallying. And I highlighted also the partnerships. So the partnerships, not just within our own organization, so the support from the CAO, the senior management team, other the redeployed staff, but then also the partnerships across the sector. So the hospitals have partnered with the long-term care sector. I was invited and I brought along a director of care to a call last week where the Grey Bruce Health Services had 60 staff on the line who had put their hands up to say they would volunteer to be redeployed as a crisis response team into a long-term care home in Grey Bruce if it was needed. And so they had 60 hospital staff on the line, and they invited Cynthia and I to come and give a highlight about long-term care, and then did a question and answer. And these are the kind of partnerships that are going to make our health system in Grey Bruce and provincially that much more stronger, responsive to the resident, patient, client, citizens' needs. The partnerships have been incredible. So in the body of the report, there's a lot of information about the other initiatives that we continue to update and sustain, and I'm happy to answer any questions.
Thanks, Jennifer.
Questions?
Great report. Questions from the committee. Councillor Leary.
Thank you, Mr. Chair. Jennifer, I've talked before about my time at Lee Manor, probably going to Lee Manor every day for a year or so. Never once did I always talked about the best part of Lee Manor was the staff, but never once did I see a PSW treat my mother with anything other than perfect professionalism. And I was a little bit thrown off guard here to see that there's been a couple with misconducts and disciplinary action taken. Is that uncharacteristic as a whole, or is it related to the extra stress they're under, or is this just isolated?
So I'm just wondering if, is this part of the closed?
Yes, yes, it is. So
report?
this will be
And so
discussed under the
maybe-
closed report.
Okay. Sorry, I apologize for that.
That's okay.
The other
Can
thing
I
I wanted
just-
to ask about was, yep.
Just to say, because we are in open session here, just to say that like any workplace, and especially one that delivers face-to-face personal care, we are held to an extremely high standard, and we take these situations, every single one of them, very, very. So I would want anyone who was watching this broadcast to know that we leave no stone unturned when it comes to dealing with these things, and we'll provide the committee with some additional detail when we go into the closed session. But we don't have an issue here, and I would want everyone to feel that.
Thanks, Kim.
Okay, thanks. I apologize, Mr. Chair. I just wrote a couple things down and I completely forgot. So just to make sure I'm not going on the wrong road again, I also wanted to talk about compliance orders with the Ministry of Long-Term Care inspector that was on site for Grey Gables. Can I talk about that now or later?
I'm just
Heather?
Jen, is that
It's
part
not-
of the?
It's not a result. Like I was just looking at the date. So the inspector came to Grey Gables for 2 days, February 11th and 12th, 2020. And it was just a follow-up meeting from the previous order on the 14th of June, 2019. So I think it should be okay to talk about that. I'm just wondering about the timing of that. So like that's 8 months later. So there was an order on the 14th of June in 2019, and the inspector doesn't come back for a follow-up until 8 months later. Is that normal?
Jennifer?
Well, sorry, thank you, Mr. Chair. So it depends very much on what the compliance deadline date is for putting in initiatives to resolve the order. And so this order is related to 24/7 registered nurse coverage. And if I'll just remind the committee that under the current legislation, even having an agency RN does not meet the compliance. So they gave us a very long deadline to continue to implement our strategies to hire our own registered nurses. We have hired and successfully recruited some registered nurses, but not until after they had returned in June to do that follow-up. So that's why they left. They came shortly after the deadline for having 24/7 RN coverage. When they arrived, though, we were continuing to use agency RN to fill the gaps from our own registered nursing complement.
Okay, so the 8 months was to your benefit then, correct?
Yeah. Yeah.
Okay.
That's correct.
So that's really what I'm trying to find out, whether it's because then the follow-up didn't come until February 18th of 2020. So that's when you got the report. So that's not a benefit to you, I'm sure, but is that normal? Like that's a long time too, from June.
Yeah, and I can't speak specifically to the strategy of the province, although I can say that there has been, prior to COVID, there has been initiatives to have inspectors return in a more timely manner and respond in a more timely manner to complaints, concerns, inspections, follow-ups. So that was starting to happen, and then COVID-19 happened, and the world looks slightly different now, and we'll see what a new normal looks like after. But our experience has been both, that the inspectors have returned there in a timely manner, and then other incidents we've had where it's been many, many months before they were back at the home to do a follow-up.
Okay, so I'll tell you where I'm going with this. I'm just looking. I just wanted to ask you, Jennifer, if there's a list that you're keeping of deficiencies, and if that's a deficiency of, inspectors being late or taking a long time to get reports through, I'm just wondering if we shouldn't have some kind of a list and kind of document things as we go along here, because I think one of the positive things out of this whole COVID thing is our provincial government has been smacked right in the middle of their forehead, and they're realizing now that their treatment towards long-term care has been below average, and I think we have to, at some point, we're going to have to be prepared to send a stern message to our government that we need some things changed, and certainly on the money side of it. And maybe Kim, you can speak to that, because if we start lobbying the government for more money towards long-term care, which we should be, because it's health care, and we should not be paying what we're paying for health care. But timing is everything, and I'm not sure if when we're in the middle of a renovation and getting money from the government, now is not likely the time for lobbying for more money. But I'm just wondering if there's been a discussion, because I think the government's been open. Well, all the municipalities are open towards our long-term care. They're suffering in something like this. So there's certainly deficiencies, and I think the government's starting to recognize it. And I think we have to be prepared to send them a list or a message of things that we need to be active on.
Kim?
Thanks for that question, and through you, Mr. Chair. I can say that Grey County has delegated on long-term care at almost every annual meeting since I've been here, and so over the past 5 years. And Western Ontario Wardens Caucus, so on behalf of all of the 18 upper tier municipalities who all have long-term care responsibilities, we've also, as part of our briefing documents back to the province, have flagged, a number of issues to the province that we like to see them pay attention to. I will have a redevelopment update for you shortly on this agenda, and to speak to some of the more recent conversations that we're putting together to have with the province as well. So absolutely, it's something that we have been doing and something that we will continue to push for, to ensure that there's a really solid understanding of some of the challenges that we face.
Great, thank you.
Thanks, Kim.
And if I might, Mr. Chair.
Go ahead, Jennifer.
I'll just add that we're active members of Advantage Ontario, which is the association that we belong to, and they play a very active role in advocacy for long-term care on many areas. So I know that they have been sitting at the table with the province advocating for a variety of initiatives specific to COVID and then outside of COVID as well. And they've been doing that quite successfully, so we can keep this committee up to date on those initiatives as well.
Right, and I think just to follow up, one of the things I wanted to mention too is I think we're all finding out during this COVID experience, our PSWs don't make enough money, which is something else that we're going to have to address at some point, and that's looking for more money from the government to make up for that. But anyway, that's for a day down the road. Thank you, Mr. Chair.
Mr. Chair.
Go ahead, Mr. Warden.
Thank you. And this is sort of a high level, and I certainly hear that the comments that Councillor Leary is referring to, and I think through this whole COVID-19, we've really understood a lot more about PSWs and about being in one location and front line, and there's a number of conversations that have happened and have been discussed in the sense of we think that they're maybe should be elevated to a higher level. And I think there's going to be a lot of conversation coming out of this as COVID-19. I will say, just from a high level, from conversations that I've had, I know that the provincial government was working on the recommendations that came out of the Wetlaufer inquiry, and there's a lot of moving forward parts that they were in the process, and then COVID-19 hit, and then, as we all know, governments have been certainly preoccupied with dealing with this. And moving forward, I think I will comfortably say that there will be some changes coming. I know the provincial government is working on moving forward with that at the very preliminary stage. I will say that myself and the CAO and a municipal or a provincial representative have had a conversation about a few things that I can't really share at this point, but I know there's a lot of things, a lot of moving parts, and I think I would suggest that we don't want to get too negative, but keep it positive of looking forward of what can be a positive move forward with PSWs in our homes and provincial guidance and guidelines with regards to long-term care. So I certainly echo your comments, Councillor Leary, and I think others have had those same comments, that we realize that PSWs, the frontline workers, there needs to be a bit of maybe a reset button on that. But I think at this time, certainly continue to have those conversations, but I think that moving forward, there will be some provincial guidelines and directive and discussions that will carry on out of this pre or post COVID-19, whenever that is. But certainly there is certainly a feeling that there maybe needs to be a bit of a reset button there. So I just caution on the side of being too critical, but certainly being suggestive in the sense that changes do need to be made, but we want to be part of that, working forward in the sense of moving toward a new model, a new direction. So I'll leave it at that, Mr. Chair.
Thanks, Mr. Warden. Just a blanket statement for me, my own personal views is that once a pandemic is over, the way long-term care business is being done in the province, I think it's going to be a completely different way of doing business. I really feel that there's just many things we've learned from this, and even the way we make new homes, I think it's going to be a completely different way of doing things. That's just my own personal opinion.
Mr. Chair, if I might.
Go ahead, Christine.
Thank you very much. And through you, Jennifer, I just want to acknowledge the detailed work you've done on this report. And specifically, I'd like your attention on page 25. You talk about going forward, we'll continue to work on these strategies, implement outbreak protocols, manage and monitor PPE supplies, and ensure ongoing communications with residents, families, staff, and community. That really intrigues me, and I was wondering, first off, when that report would come forward, because I really think it will chart the course and the direction of how we're managing long-term care. So most interested, certainly going through COVID, that will make some changes. Part one to my question. Part two is I was wondering within our operational or the operational reports that our executive directors provide, is there an opportunity to include a section, and I'm wondering if this needs to be through the province or if this is something that you can achieve as director of long-term care. Within those operational reports, could we also include a section on outbreak protocols? And so that we would be able to manage and gauge the performance of how we're dealing with them within each home.
Jennifer, any comments?
Okay, thank you. What I can say is that right now there's a lot of moving parts, and we're expecting some guidance from public health, from the province, and then regionally we're actively working on preparing some guiding principles for what kind of a phased in approach of opening up long-term care might look like. And so those pieces need to align and come together. I think that we can add whatever to the report, whatever is necessary for making sure that this committee is up to date. We did include in these reports, the open session reports, some information about outbreak. And I think that as we come to learn what those strategies of a new normal are going to look like, I will definitely be bringing those to committee for discussion and input. And at this time, we're just working through what a new normal is going to look like.
Thanks. Thanks, Jennifer. Councillor Leary?
Mr. Chair, your comments just remind me of something I wanted to ask him about. Where are we at in terms of the design of the new builds with Rockwood and Grey Gables?
I wonder, Councillor Leary, if we might pick that up a little further on our agenda under redevelopment.
Okay.
Okay. Councillor Mackey.
Thanks, Mr. Warden, or sorry, Mr. Chair.
No.
I just want to, comment on Councillor Leary's remarks. Certainly the deficiencies in long-term care have been exposed now, and members of this committee have been aware about the staffing shortages and the number of hours, or the too infrequent hours that our staff have to provide care. I think going forward, this is going to be a tremendous opportunity. I think the public now understands and sees these deficiencies. So it's terrible that it takes a tragedy like we've seen in our long-term care to invoke change, but that's too often the case. So I am optimistic, but I think we do need to collectively advocate for these changes. This is the time to strike within the next few months. So I'm really happy to hear that Jennifer and Advantage Ontario is putting together a list of what they'd like to see happen.
I have a question. You know, the province certainly did for all of our essential service workers have indicated that there's going to be a $4 an hour increase, I believe, for the next 4 months. Have we as a county received any information, and when do we think that would be implemented?
Okay, I guess Jennifer, do you comment?
Sure, thank you, Mr. Chair. So that announcement was made a couple of weeks ago, and information is about that and is trickling in. So we have not yet got the full picture from the province on how that pandemic pay works. We're committed to making sure that all the folks that are eligible for it are getting it, and that we're tracking it appropriately so that we can do the reporting mechanisms back. We just don't have any of a full picture of what that looks like from the province at this point.
Mr. Chair, if I may, Jennifer, do you, our staff that from other departments that stepped up to help in our long-term care, will they be eligible for this increase?
So do you mean internal in the long-term care homes, other departments, or outside of long-term?
So our staff from the outside departments that have went and have done the screening and helped in the laundry and things like that that we've heard of, will they be eligible for the $4 an hour pay increase?
So based on what we know,
Yeah.
they do not meet the eligibility. Sorry, go ahead, Kim.
No, that's right. You're fine. Go ahead.
Okay, just based on what we know at this point, they do not meet that eligibility criteria.
Well, that's
Thanks,
too
Jeff.
bad for the people that went above and beyond, but thank you.
Okay. If there's no other questions on the motion before us, I'll ask for a vote. All in favor of the motion? I believe that is carried. So we're going to move on to our agenda. We're now going to go into closed session. I'll read the motion. That the Long-Term Care Committee of Management does now go to closed session, turn to section 239(2) of the Municipal Act 2001 as amended to 1, to discuss 1, personal matters about identifiable individual, including municipal employees, operation report, and 2, labor relations and employee negotiation operating report. It was moved by Councilor Robinson, second by Councilor Mackey, that we would go in closed session. All in favor to go in closed session? Thank you, Rob. I assume we are now in open session. We only discussed what we went and discussed in camera, nothing more. We're moving off the agenda. We're down to redevelopment update. Kim, I believe I'm going to turn it over to you.
Thank you, Mr. Chair. So after our last council meeting, I confirmed with the province that we had in fact passed the bylaw to secure the new piece of property for Rockwood Terrace. I'm now trying to set up a call with the people at licensing at the Ministry of Long-Term Care to confirm what the next steps are from their perspective. Some of you will recall from earlier discussions about redevelopment, there's an aspect of the project that has to do with community consultation and confirming the site of the new facility. Before we got into the COVID piece, the province had made some adjustments to that so that they had greater flexibility. And so what I need to understand from them is whether they intend to exercise that flexibility, simply confirm site, and then allow us to move forward from there. We also had earlier created a communications plan for the project that was submitted at the time we put the application in. I want to revisit that. Certainly the information that's on the Bray County site with regard to redevelopment is quite dated. And so I think if we're going to move into a new phase with this, we might want to archive the material that's there and then move on forward from that. I did want to talk to the committee about the kind of the process independent of what the province's requirements are. Because we have a significant piece of property and there's a lot of potential here to take things in a number of different directions, it's my advice that we get to an overall vision for the site that will then allow us to site the long-term care home within that property overall. So as a first step to that, I'm intending to bring in some West Grey folks and some county folks. So at a staff level, economic development, planning, the CAOs, et cetera, to really look at the site overall and see, based on what we understand with regard to the roads and the servicing and the things that we feel are important to have on the site, what should go where. In addition to the long-term care facility itself, if we're looking at this site to supply that campus of care and that additional housing, the ability to age in place, I think there may be some other amenities that we want to see there at some point, like some sort of a community type facility, or opportunities for more active living, whether that's a trail system or some sort of a recreation facility. How do we want to deal with things like energy efficiency and total cost of ownership? So all of those discussions need to happen. Our paramedic base in Durham is one that probably needs to be looked at in the very near future. Is that another physical aspect of this that we should be looking at, is intending to have a new paramedic base on this site as well, and on it goes. So the intention would be to have that initial brainstorming session, identify some of these things, and then bring that back to this committee and to council. The points that were made earlier in the meeting about how long-term care may change in the future are well taken. I'm hoping with the discussions with the province that we can get a little bit of insight from them about where they're thinking things might go, whether they feel that the design guidelines as they stand for new homes are sufficient, or are they likely to change? It's my understanding that some of the homes that struggled most significantly through this last little while were the Ulster-styled homes where you had more shared rooms. The current design guidelines still allow you to have semi-private or 2 people into a room. I want to know if that's going to continue or if we're going to go just all private. Do we need to have space, isolation space, thought out and built into a new building before we start? So all of those things are questions. There's still an outstanding question with regard to with the Grey Gables property and what might happen there. I'd like to know if there's some sense of the timelines. When we got into COVID, the province took the timeline around that next set of application decisions off the table. So are they intending to bring that back for discussion at any time soon? If we are going to go out for for RFP around design or design build, again, we're going to have to talk about the pros and cons of the different models. Are we asking people to take on 2 projects or 1? So I need to understand that as well from the province. So that's where we are. I think for the June 9th meeting, if I can get the staff visioning session set up on the 4th or 5th, I at least can have some high-level discussions about some of the things that we talked about. And hopefully I'll have had an update from the province at the same time, so that by the time we get to the next meeting, I can give you some more information.
Thanks, Kim. Councillor Leary, did you get your question answered?
Well, sort of. Kim, she did talk about, you know, whether we were going to double up rooms and that. I wish I knew where I heard or read this, but I heard someone say that moving forward, long-term care homes will be single rooms. And that scares me to death, because we've already gone ahead with this entire project without any cost analysis. And that's going to make a big difference. If these new builds are going to be single rooms, that has to be a bigger building. And you know that, Mr. Chair, it's just not going to work. So I think the sooner we find out about the actual design and layout, what the government's going to make us do, and if they are making us have single rooms, are they going to pay more money because of the extra cost that will occur? But yeah, she did pretty much cover that. Thank you.
If I can add,
Go ahead.
you know, depending on what we do and where we go with additional housing on the site and the model that that housing comes together under, you know, I really want to look at a business plan for this whole thing, and to see whether or not there are any opportunities for us to offset these expenses one way or another. So there's just a lot of moving parts and a lot of unknowns right now, but your points are well taken.
Thanks, Kim.
Mr. Chair, if I might.
Go ahead, Christine.
Thank you, and through you. And I do appreciate there are a lot of moving parts, certainly when you're doing a new build, that is taken under consideration. I quite like the idea of the brainstorming with staff, and also understanding what the functionality and the footprint will be of the Rockwood Terrace property. What I'm most interested in is understanding that there's, you know, maybe a business plan coming forward, a staff report dealing with brainstorming. Could we have a timeline in place that would identify when these milestones are taking place, which will also include a design component and an RFP consideration? So looking at you know, where we are now and the balance of 2020 and going on to 2021, what are the milestones that we need to achieve in order to have this building in place and obviously open for business for 2025.
Thanks, Christine. Before I turn it over to Kim, I really, again, feel that with the pandemic and what's going on, the province is going to have to extend this 2025 date. There's just too many moving parts, even for them, to make that date stick. Kim, do you want to comment on Christine's?
I am 100% behind the idea of having a project plan and the right people brought into this to undertake the work moving forward. That's absolutely where we want to be. I need to know from the province, though, where they see any changes coming, right? We don't want to move ahead only to have to double back. So if they can provide us some assurance of, you know, and some stability around what design guidelines there are, what potential, like if they're thinking that they're changing the funding model again or anything like that, we need some indication of that so that we can plan and make decisions appropriately. So I'll be looking to them to provide some confirmation and some assurance that we are in the right place to be able to move ahead. And if we're not, what needs to happen from the province's perspective, and when do they anticipate seeing that happen? So I think we're united in the right goal, and I'm
Sure.
hoping that we will be able to move forward.
So
Thanks, Kim.
supplementary to that, Mr. Chair.
Go ahead.
So I'm wondering, through you to our warden, if Warden McQueen's had any conversation with MPP Walker in terms of potential changes to guidelines for long-term care or a funding model and just a path forward to move this development along.
Mr. Warden?
I have not had any high-level discussions with Minister Walker on that. I think just more with the ministry staff. I've had a couple of conversations, but certainly I want to have some conversations there, and certainly we'll maybe push to have more further conversations about that. Just going back to the whole part about with Kim's comments with regards to a bigger picture, certainly developing a site plan or developing how the site could be developed is a good idea. And then I think once you develop that component, then you develop where on that site the long-term care facility would go, and then you could get moving on with that part and all that. I certainly would encourage, and I think you mentioned it, Kim, with great discussion with West Grade Council and your staff, as they may have spots for future police stations, future fire halls, future infrastructure things that maybe it's on their plate. And that goes back to you, your worship, Robinson, in the sense of having those, because this is in Durham, and that's your largest urban center. So certainly working together makes a lot of sense. You know, that 32-acre site inside the Durham boundaries is a good opportunity. But I think in the sense of time frame, developing the site, but not getting hung up what goes where, just sort of developing the site and then determining where you might have that site for the long-term care, and then you can get moving with that component for sure. Just going back to the comment with regards to Councillor Leary, certainly I can see there will be new direction in the sense of able to isolate individuals in the long-term care home. But one of those things could be with, and we see it in a lot of new buildings, is a partition wall that moves in and out, which won't have this, I wouldn't think would have the same cost as building individual rooms, but the ability to isolate rooms through a partition wall. And we see those at a number of our different facilities that may help curb some of that cost. You still achieve the objective of having to isolate individuals, but then not having as big a cost. So I think there's a lot of discussion that needs to happen, and a lot of options that could be to achieve that same thing with less cost. So, you know, those are things that I think could be implemented. But certainly as your warden and that, you know, there's times where it comes to a point where there's some high level discussions. I would think that would probably include staff, probably myself, maybe the chair of long-term care and the director, in the sense of, because we'll want to have some conversations here, and, you know, with the direction and guidance of our CAO, we know that we are moving forward with these projects, and very important that timing is something. And I certainly agree, Mr. Chair, 2025 is maybe something that I know that was set a long time ago, and there may be some resets on that, because moving forward, we want to make sure we get it right. And there's, you know, taking time to get it right is just as important as doing it. And we just got to steady as we go. And Madam CEO, we certainly will, you know, entrust in your guidance of how we move forward with this. But certainly there's a lot of components that need to be attended to. And my clock's going ding dong, so I better shut up.
We're getting used to that.
Councillor Leary, go to you first. I've seen your hand up.
Well, I just wanted to quickly mention, just from Christine's comments, I wanted to ask that we not go to a motion, and just kind of remember that we're still in the middle of an emergency, and we should be sensitive to the CAO schedule. And by the sounds, but I think she's on the same page as, you know, some of the things that we've asked about. So I think we're going to get there without a motion. Thanks.
Thank you. Councillor Robson.
Thank you, Mr. Chair. One of the things that I would propose is that we consider an email delegation. If there's an opportunity to speak with the Premier or Minister of long-term care, I think that would be appropriate, just to identify where we are in the process, and that we've got some questions, and that we, you know, we're using our due diligence, but we want to get this project underway, and we've got residents that wish to live in this new facility. So that's one of the things I would look at this committee to consider, and ultimately council to make the decision of putting this as a delegation to AMO. Also, at the appropriate time, we do need to get a communication out to our residents again in terms of where we're at. Residents know that we've got the property in place, but what are the next steps, and what can our Grey County residents expect in terms of the development of Rockwood Terrace?
Thanks, Christine. Kim, care to comment?
No, as I said, I think that we need to revisit the communications plan and make sure that it's accurately reflecting what we know and where we are, and move forward on that. Absolutely, people have questions. Although we've passed the bylaw to obtain the new property for Rockwood Terrace, we don't actually close on that deal for a little minute too. So I am a little bit sensitive to just to make sure that everything's done and dusted from there before we go too far ahead. But I don't think there's any reason that we wouldn't be able to communicate in a more fulsome way with the public sometime in June, at least before the summer comes and people kind of attend to different things. I would like to get something in front of people before that.
Thanks,
Mr.
Kim.
Chair, Mr. Chair,
Go ahead, Mr. Warden.
just to follow up with, thank you for the comments. Certainly, as Councillor O'Leary has said about COVID, and we need to sort of move through that steps of sort of starting to, what's the new reality of COVID. A good idea. We know that AMO is going to be a virtual conference, and certainly there will be details coming out with the opportunity to set up delegations, I'm sure, with ministers and stuff. But I must remind everybody, we can always make those delegation requests at any time, that if we feel it's important that we need to talk to the Minister of Long-Term Care and through our Minister Walker and others, we can always make those requests. It's interesting how one thing out of COVID-19, we can have meetings pretty soon, pretty quick, with Zoom and everything now. So it seems to be, it has, the one thing out of that is inspired us to other options of meeting and maybe getting some face-to-face answers and questions, or questions and answers to our questions. So certainly, Your Worship, Councillor Robinson, in the sense of making that delegation request, I can work with Kim and we can bring back that further discussion maybe in June. But certainly, it doesn't hurt to ask for those. And is August? Is that maybe too late to have some guidance and if we need that? And I think from our Madam CEO, if you feel that from you're not getting answers and we need to do that, certainly
Right.
We can move toward that. That's another option, right? And that sort of thing, because we're in the middle of one or two developments here, and there's so we sort of have a lot on the table here right now, and we want to make sure we get some of those answers and how do we move forward, and so there's a lot of moving parts, but let's and if we make those requests, it's sort of like thank you very much. How do we move forward? So can we encourage your guidance on all this stuff, so we sort of open up our arms, or help us out here, and it's not a criticizing delegation, but it's more or less an information and here's some ideas, and I always like when we do delegations that we don't go there criticizing it, but you come with concerns and you come with solutions, and that's always a positive way of moving forward in a lot of ways. So I hope that helps.
Thanks, Mr. Warden. Kim, Councillor Robson, I think we should leave this solely at the discretion of our CEO to be able to catch up, and I'm quite sure she will bring everything forward at the appropriate time to our committee and to the council. I understand you're anxious to get things moving and so on, but I'm quite sure our CEO's really talented when it comes to how to bring things out to the public and everyone else. So I think we should just leave it to our CEO to bring it back to us at an appropriate time.
Mr. Chair?
Go ahead.
So I'm wondering, could we invite Minister Fullerton out to one of our long-term care meetings? I mean, AMO's a great idea. I put it forward. I think having an email delegation for sure, but just based on what Warden McQueen had identified, that there's opportunities to have meetings with the province. So perhaps we invite Minister Fullerton out and get some questions answered.
That could very well be, but maybe I still want to fall back to our CEO to let her catch her breath and move forward accordingly. That's one of my suggestions. Kim?
Yes, and many of the aspects of the redevelopment project are actually in legislation. So there's not a tremendous amount of discretion. It's just a matter of moving through the process. I will do my very best to get us caught up so that we do have a firm sense of timelines for the June 9th meeting. And hopefully from there, then we'll be in a good place. If we want to engage with other conversations with elected officials, then we will be in a good spot to do that.
Thanks, Kim. Is there any other discussion on our redevelopment? Seeing none, I'll move forward with our agenda down to other business. Before we get to the nursing week, Councillor Robson, you had a question maybe that Jennifer might be able to ask in case she has to leave. Do you want to ask that question again?
Oh, certainly, Mr. Chair, and through you. Jennifer, I was wondering if we've had any citizen volunteers that have expressed an interest in working with any of our long-term care homes, and what your comment would be on that, please.
Jennifer?
Sure, thank you, Mr. Chair, through you. So I have not received any specific offers of volunteering within the homes. I think that people are very aware of the limitations and the goal to minimize the number of people coming in and out of long-term care homes right now. Having said that, the community support for the homes, the residents, and all of the staff in them has been overwhelmingly wonderful. The community just continues to rally and support and cheer on our staff who are working tirelessly to keep things as normal as possible for the residents and keep COVID kind of out of the homes. So at this point, that's my comments on that question. The support's been amazing.
Thanks, Jennifer.
Absolutely, and thank you for the comment.
Okay. Nurses Week. Should be a Nurses Day, 365 days a year, but anyway, it is quite well noted.
Thank you, Mr. Chair. Yeah, I'm just going to highlight some information from the end of my kind of previous. From my previous report. So Nurses Week is this week, May 11th to 17th, and it's also the year of the nurse. 2020 is the year of the nurse, so that's fairly prophetic. I don't think that was. I've read some information on social media that if only they had realized how timely that would be. So I just want to do a shout out to all of the nurses within our organizations and across our region. And we're celebrating Nurses Week by celebrating all staff in long-term care, everyone in every department who keeps everything going, are working really hard. And so one of the initiatives that we're doing to support all staff is that we're giving each team member a Grey County Color It Hero t-shirt. So they're really lovely. You'll have to watch for them out and about. They're black t-shirt with the county logo, and on the back it says Color It Hero. And they very much have earned that title. And I just wanted to acknowledge all of the hard work and the commitment and the dedication.
Thanks, Jennifer. Well done. Moving on to our agenda, it's been a great meeting. Our next meeting is June the 9th. If we no other business, I have a motion moved by Councillor O'Leary, second by Councillor Robson, that we adjourn. All in favor? We're now adjourned. Thanks, everybody.
Thanks.
Thanks. Take care, everyone. Good seeing
Okay.
you.